Phenylketonuria, or PKU, is a birth defect that causes a buildup of the amino acid phenylalanine hydroxylase in the body. It is caused by a mutation in the gene that helps create the enzyme that breaks down phenylalanine. For a child to inherit PKU, both the mother and the father must have and pass the defective gene, which would be autosomal recessive. Although amino acids are building blocks for protein, too much phenylalanine is not a good thing. Most of the time, the parents are carriers, which means they do not actually have symptoms of PKU and are unaware they have it when it is passed to their children. The defect usually occurs in people from the United States and Europe. Before pregnancy, an enzyme assay, which is shown here, can determine if parents carry the gene for PKU. Chronic villus sampling can be done during pregnancy to screen the unborn baby for PKU. If the mother has PKU and she is pregnant, she must follow her strict no-protein diet during pregnancy. At birth, infants do not actually have any symptoms associated with PKU, but without treatments, the symptoms should arrive a few months after birth. As you can see, here are some of the symptoms: behavioral or social problems, seizures, hyperactivity, stunted growth, skin rashes, microcephaly, a musty odor on the child's breath, skin or urine, which is caused by too much phenylalanine in the body, fair skin, because phenylalanine cannot transform into melanin, and that's what's responsible for pigmentation in the skin. The worst symptom, if not treated, is mental retardation, and this will happen because the buildup of phenylalanine in the system will disrupt the neurological system. Although PKU is rare, babies are screened shortly after birth to prevent more serious health effects. A simple blood test is done at the hospital before discharge, right after birth. If the results are positive, further blood and urine tests are required to confirm the diagnosis. PKU, as I said earlier, is mostly found in protein, so people with PKU should avoid foods that contain protein such as milk, cheese, nuts, or meat. The artificial sweetener aspartame also contains phenylalanine and should be avoided as well. There's a special infant formula that's called Lofenacalac, which is made for infants with PKU. And also, since people with PKU have to avoid any meat products, it's suggested that they take supplements like iron and fish oil to help replace the nutrients that are lost from avoiding these meat products. Lastly, with PKU, the most important thing is early detection. That's key to managing this genetic disorder. Early detection leads to treatment and leads to prevention of mental retardation.